Hi, my name is Dr. Sharmin Akhtar. I'm a HCPC-registered counselling psychologist and I work at private therapy clinic. When someone comes to see me, I'd want to carry out an initial assessment. So that would include information about what has brought my client to therapy. So what is it that they're exactly going through at the moment, their thoughts, their feelings, and what kind of behaviors that they're presenting with. I'd also want to know about their childhood experiences, so their relationships in the past, their upbringing, how they found school, and things like that. I would also want to know about past traumas, any significant events that they felt was quite important to them in the past. And then I would also carry out a risk assessment to find out kind of their mental health state. And finally, towards the end of the initial assessment, we'd agree on our goals and agree on a treatment plan to guide our future therapy sessions. The way in which I work is predominantly from an integrative approach. So that means combining different therapeutic modalities to tailor the treatment to my client's specific needs. So, for example, I'll use cognitive behavioral therapy, or CBT for short, which looks at the link between our thoughts, feelings, and behaviors and how they interact with one another. And the idea is that if we can change our feelings or our thoughts, then we can also change our behaviors, for example, and vice versa. The other approach that I use is psychodynamic therapy, and that comes from an understanding that our childhood experiences, those significant relationships that we've had in the past, have an impact on how we are as individuals in the present moment. So, for example, it might impact or affect our relationship, romantic relationships that we're in at the moment. So, kind of thinking about where the roots of our psychological difficulties come from. So, integrative therapy can help with a variety of psychological difficulties such as anxiety, depression, OCD, PTSD, personality disorders, and etc. Another approach that I use is cognitive analytic therapy, or for short. That looks at our relationship patterns that we've developed based on our childhood experiences and how they're influencing our relationships at present. So, using this talking therapy, we can develop what we call exits in therapy to find new ways of relating to not only others, but also ourselves. If I'm working with younger children, then I use a therapeutic modality called play therapy. As children may not always be able to articulate their thoughts, emotions, and behaviors, we use play therapy to help them process what might be traumatic events, unpleasant events, as well as thoughts and feelings through this medium. Using play therapy means that traumatic events or unpleasant experiences have been worked through in therapy so that there's much less of an impact of them in the future. So, one of the key aspects that I think makes a really good practitioner is empathy, warmth, and understanding. This means that when clients come in, they need to feel comfortable and safe to open up to you. Using empathy, warmth, and understanding, a therapeutic relationship can be established. This is when psychological theories can be implemented into the therapy to give the most beneficial impacts to the client's psychological distress. Another skill that makes a good practitioner is the idea of reflection and self awareness. This is where I take my time to think about the impact of each intervention on my client and whether they can be modified to make them even better. My hobbies and interests include getting creative, especially through painting, drawing, and also I enjoy sewing. Other activities that I also enjoy is cooking and gardening. If you're thinking about giving therapy a go, please do get in contact with Private Therapy Clinic and I'd be more than happy to discuss this further.